Aloha. Thank you for coming today to this webinar about the new MedQuest Community Palliative Care Benefit. My name is Jeanette Kojane, and I'm the Executive Director of Kukuamau. Thanks to a grant from Hui Pohala, Kukuamau has organized this series with our wonderful speakers. A shout out to our teams in the background who are making everything happen. The webinar today is for the public, and we'll have several speakers to help you understand what palliative care is and how it can help you, a loved one, or someone you care for. We will have a variety of speakers today, including a palliative care doctor explaining about palliative care and sharing a real case, an overview of the community palliative care benefit, what it does, and how to get it. You'll then hear from a palliative care nurse and a palliative care social worker who talk about what their roles are on the team. We'll share where to find more resources and end with a local family talking about how palliative care helped them and their mother. So after the presentations, there'll be a live Q&A session, so please put any questions you have as we go along into the Q&A. So thank you for coming, and we'll start the presentations now.
Hi, I'm Judy Moore Peterson, MedQuest Administrator in Hawaii. Aloha, and thank you so much for attending this webinar series on the new Medicaid benefit for community palliative care. You know, we all want high quality care for ourselves and our family, especially when we have a serious illness. Unfortunately, we have a fragmented, confusing healthcare system. And the more complex your health and healthcare needs are, the more challenging it is. Navigating the healthcare system to get comprehensive, coordinated care can be extremely difficult. And community palliative care helps fill this gap and is the type of care we need for individuals with serious illness. It provides extra support from a multidisciplinary team that bridges all care settings, geographies, and cultures. It truly represents a whole person approach to care that we all value. For this reason, we at MedQuest recognized the need to make community palliative care a regular part of the Medicaid benefit. With the approval of the federal government, we were able to amend our state plan, and we're very proud to say that Hawaii is the first state in the nation to offer this. We're excited to present further details on community palliative care benefit throughout this webinar series. And on behalf of Hawaii's Quest members, mahalo for your help in making community palliative care more accessible for all of our communities across our islands. Mahalo.
We are so glad today to be joined by Dr. Daniel Fishberg, who has served as the medical director of the Pain and Palliative Care Department at the Queens Medical Center for more than 20 years and is the chief of division of palliative medicine and a professor of geriatric medicine at the John A. Burns School of Medicine. Thank you, Dr. Fishberg.
Thank you. Aloha. You know, as a palliative care doctor, really a day doesn't go by that I do need to define what palliative care is to somebody. And it might be to a patient or a family member. It might be to some of the learners we have here in the hospital, or it might be actually to some of my more senior physician colleagues who might have sort of older ideas about what palliative care is. So what I wanted to do today was to take a few minutes to actually define our current definition of palliative care and talk about its role in relation to other medical treatments. I also want to list the documented benefits of palliative care so you would understand why we think it's important for people to understand what palliative care is, people with a serious illness or people in their families that are caring for them. It's important for them to know what palliative care is too. So the definition of palliative care is specialized medical treatment. It is a medical specialty like other medical specialties. The focus of palliative care is preventing and reducing pain, other symptoms, and stress for people that are living with a serious illness. Our goal in palliative care is to improve quality of life for people with serious illness and their families. That's something that's a little unique about palliative care. The scope of our treatment is not just an organ system or even the individual patient. It's the entire family because families go through a serious illness together. Palliative care, and this is very important, is appropriate at any stage of an illness and in combination with curative and life-prolonging treatments. It's not instead of those treatments, it's in addition to those treatments. Palliative care is provided by teams with specialty training, and that's a really important element of palliative care, that it is a team activity. That means physicians, nurses, social workers, counselors, and other providers of healthcare all working together to provide an extra layer of support to the patient and the family. Those are sort of official definitions of palliative care, but a really experienced nurse many years ago shared with me this shorthand definition of palliative care. She said to me, palliative care is about comfort, support, and choice. Comfort, managing good symptom control, pain, nausea, shortness of breath, other symptoms, support for the patient, for the family, to help them do the things they want to do every day, live their life the way they want to live it, and choice. So the patient and the family are getting good information that they can use to make plans about how they want to spend their time and where they want to spend their time, and that they can stay in charge and in control of their treatments. A colleague of mine at University of California, San Francisco, Steve Pantelat, gave me this definition. This is what he says palliative care is when he's talking to patients and families: helping you live as well as you can for as long as you can. And I think that's a really good shorthand definition of palliative care. And then another colleague of ours, Dr. Ira Byock, a major leader in the field, chose this as the title of his last book, The Best Care Possible. And for me, I really do think of palliative care as being a part of the best care possible for anybody living with a serious illness. At its heart, it's really important to recognize palliative care is preventive care. It's about preventing healthcare crises. And that's because when you're getting palliative care, you've got a team that's focused on managing symptoms and quality of life. And that means a plan is in place to help you with whatever symptom you've been experiencing. Could be pain, could be nausea, and that plan is in place to try to prevent any kind of crisis. But they also, as a palliative care team, have to be available to you 24/7, 365 days a year, because believe it or not, pain and other symptoms don't only become problematic Monday through Friday, 9 to 5. So the team has to be available all the time to help anytime anything happens. And really, very important, it's being recognized by other medical specialties outside of palliative care. Heart doctors, cancer doctors, all of their medical societies now in their treatment guidelines recommend early referral to palliative care as the highest standard of care, not waiting until a symptom is out of control or somebody is very, very sick. Really bringing in palliative care early in the disease management process. Another really important point, I've made this before, but palliative care is not instead of your usual care, it's additional care. It complements the treatments you're getting from your other doctors. People can have quality of life while they're getting treatment for a serious illness. People do not have to choose. As Dr. Pantelat said, it's not about living longer or feeling better. We want everyone to live longer and feel better at the same time. And we'd really like to remind my physician colleagues that palliative care is not based on prognosis, it's based on need. If the patient and the family are having needs while they're being treated for a serious illness, palliative care can help. So I want to take a few minutes to go through a real life example of a case. Everything in this case is accurate. The only thing I've changed is the name of the patient and his age, just to provide a little anonymity. But Bobby was 58 years old, and he had a lung cancer that had been initially treated, gone away, and then came back. That's usually a very serious situation. A lung cancer that comes back like that often is something that we cannot cure. He was getting treatment from his surgeons and his medical oncologists, but he was having some pretty serious symptoms. And so he was referred to our outpatient palliative care program. His pain was really out of control, very severe pain, despite best efforts by his other doctors. They were not ignoring his pain, they were doing their best, but they weren't pain specialists, so they were really having a hard time controlling Bobby's pain. Because of the way the lung cancer was affecting him, Bobby was having a lot of cough and trouble breathing, very short of breath. Between the pain and the breathing problems, this was making Bobby very depressed. He was weak, he was tired, he just didn't have the energy to do the things he wanted to do, and just life had lost a lot of its zest. He spent all his time just sort of dealing with his doctors and not able to do the things he wanted to do, spend time with his family, garden, work, and play golf. Those things were just all in the past. He couldn't do any of those things anymore. So Bobby got started on some new pain medicines by his palliative medicine team. The palliative care team recognized that his pain was complex. It had a nerve pain component, it had a muscle pain component, and so we used special medicines to relieve those aspects of Bobby's pain. Bobby's pain came under much better control. And maybe not surprisingly, when his pain got better, his mood got better too, because it had been very depressing for him having pain unending every single day. By the third visit, Bobby was able to talk a little bit about his hopes, his worries, his priorities. Now that his symptoms were under control, he was proceeding with his cancer treatment. And Bobby basically really wanted to fight this for his family. He was a relatively young man. He wanted to take all the treatments he could get in hopes of beating this. But he recognized the odds were somewhat against him. And if God was going to take Bobby, he didn't want to have the end of his life spent on machines or in intensive care units. So that was all documented on a form, a POLST form, we call that, a provider order for life-sustaining treatment, which basically said Bobby wanted all treatments that would help him get better, but if the end of life had come, he didn't want to have that artificially prolonged on machines. Bobby started on his treatments, and boy, did he have a tremendous response. This was an early kind of treatment called immunotherapy. This is a few years back when immunotherapy was a very new thing for us, but it was a great response for Bobby. His cough and breathing got better almost immediately. He was actually able to go back and do the things he used to do, spend time with his family, garden, golf. He got his life back, basically, his pain and breathing under better control. Actually, he had such a great response to his immunotherapy that Bobby didn't actually need his pain medicines anymore. He came off of all pain medicines. And in fact, he didn't really even require routine palliative care follow-up after a while. And I'm happy to say that 8 years later, Bobby remains cancer-free. But I want to make the point that palliative care was brought on board based on his need, not his prognosis. And Bobby had a lot of needs early on, but thanks to the great work by his cancer care team, his symptoms came under much better control after palliative care had gotten him started and helped him through his treatments. There's a lot of data out there that shows that Bobby's experience is, while it's exceptional, it's not actually unique. Palliative care does reduce symptoms like pain and shortness of breath. It improves quality of life. It's associated with higher family satisfaction. It actually can help improve the transition of care. So sometimes people are in the clinic, at home, might need to be in the hospital, might need to be in rehab. Palliative care can help with these transitions through all of these different settings, making sure the family stays informed, the patient stays informed, and the doctors are all talking to each other. There's actually some data even that shows that palliative care sometimes might prolong life. So I'm just going to refer to this one very important study that appeared in the New England Journal of Medicine. It was done at the Massachusetts General Hospital in Harvard. They had 151 patients with brand new or metastatic lung cancer, similar to Bobby's situation. And they either got the routine standard oncology care or the early referral to palliative care that we now know is the recommended standard of care. The patients that got early palliative care had a much better quality of life. When it was measured, they had less worry, they had less sadness, and what was really impressive is they actually lived longer than the group that had not been getting palliative care. Now, we don't go around saying that palliative care, this proves palliative care makes you live longer, but there are multiple studies that have shown patients getting palliative care may live longer than patients not getting it. And importantly, there has never ever been a study that showed people getting palliative care live shorter. Sometimes some doctors might get the misunderstanding that people have to make this choice between living longer and feeling better. And this study clearly showed you don't have to make that choice. You deserve both. What we're really excited about here in Hawaii is that palliative care is now available across many different settings. For quite a few years, we've had palliative care in many hospitals across the country and here in Hawaii. But what's been a gap is palliative care in the community, palliative care for people who are at home with their families, palliative care for people who might be in a facility doing some rehab and things like that. And what's been tremendously exciting about this new MedQuest benefit is that now we have a community palliative care benefit, the first in the nation that's federally funded here in Hawaii to provide community palliative care wherever the patient is. So yes, we still have palliative care in the hospital, but now we can provide palliative care wherever somebody is. And actually, it's become one of the most important things we do here in the hospital. Once we're on top of the symptoms and helping with all of the comfort, support, and choice issues that we need to help with, one of the top priorities for us is connecting the patient and family to a community program so they can continue to get palliative care when they leave the hospital. So I want to summarize now by reminding you that palliative care is preventive care. It's focused on relieving pain and suffering. It improves quality of life for people with a serious illness. It's an interdisciplinary team that provides extra support. We think of it as being person-centered and family inclusive because the family is the unit of care. It should be combined with curative treatments. It's not to replace curative or life-prolonging treatments. Palliative care should be based on need, not prognosis. We have patients who are being treated for a cure, and they still can get palliative care. And early referral very much now has become the standard of care across medical specialties. I want to thank you very much for your time. Mahalo.
Anita Jewell's nursing career spans more than 40 years. A 2-week vacation in Hawaii turned into a permanent move after acquiring a nursing position at the Queens Medical Center. After 15 years at Queens Cardiovascular ICU, she spent the next 20 years navigating the realms of case management, administration, and population management. The combination of clinical administrative experiences has led to unique opportunities to participate in community projects dealing with population health, health management, access to care, and transitions of care. Thank you, Anita.
Aloha. Thank you, Jeanette. And thank you, everyone, for taking time out of your busy day to learn a little bit about this new, exciting palliative care benefit. So today, we're here to talk about the benefits of palliative care in general, the new MedQuest Community Palliative Care benefit. We're going to talk about who qualifies and where you can get palliative care, who provides palliative care, and how can you find out if you qualify. So the benefits of palliative care. Palliative care gives extra support from a caring team that helps you spend more days comfortably at home with family and less visits to the hospital. Helps you by providing support for your family, your caregivers, and your loved ones. Help is just a phone call away, and it's available 24/7, 7 days a week. Helps you to manage problems of your illness, such as pain, trouble breathing, and upset stomach. Helps you by explaining care and treatment options to you and your loved ones. Helps you get with your doctor so that your doctor knows what is important to you. And helps you connect to other resources and programs in the community. I see this lovely picture of these two beautiful ladies. And to me, this slide means it's palliative care is about family. This slide is about family. And truly, when a family member has a diagnosis of a serious illness, the whole family has to deal with it. So palliative care is about supporting you, maximizing your health as you work through this serious illness, and help you with your relationships with your family as you all deal with the stressors that often accompany this serious illness. The new community palliative care services benefit. This is a game changer, and this is a good thing. Palliative care is now a community benefit for MedQuest members. We're the first state in the country to achieve this. Palliative care can be provided earlier in your illness now. And also, palliative care can be provided at home or in other settings after a hospitalization. So after discharge from the hospital, if you are receiving palliative care services in the hospital, which was historically already been provided, once you are discharged, this palliative care level of care can also follow you home or to wherever you're discharged to as you transition. So it can follow you to rehab or your nursing facility. And finally, this preventative benefit is designed to prevent burnout, minimize stress, and prevent hospitalizations. The new community palliative care services benefit is a layer of additional services provided on top of what is already being provided. This service is designed to work hand in hand with other services that you may already have, such as services that provide your medications, medical equipment and other supplies, behavioral health care, home and community-based services, home-delivered meals, personal emergency response system, or PERS, adult daycare, etc., and more. So who qualifies for this? This is for MedQuest members. You can also be Medicare, Medicaid, also known as Medi-Medi. And you have one of the disease qualifying conditions. I'll go over that in the next couple of slides. And also one example of ongoing functional decline. So here's a list of disease qualifying conditions, and I don't expect you to memorize it, but the takeaway I want you to have from this slide is that essentially every major organ in your body is on this slide. Heart, liver, lung, brain. Anybody with a serious illness who is struggling with that illness should be considered for palliative care. And to me, this means that more people will be eligible for this care, and more people should be considered to receive and be considered for palliative care services. The list is very comprehensive, so it is something to me that should include everyone that has some type of serious illness and is struggling with it. What does a struggle look like? So if you're struggling with a serious illness, this is a list of examples of functional decline. It's a partial list. There could be other details, but essentially it's when you're no longer able to do your daily activities without some type of help. And this might look like, so someone who needs oxygen all the time. You need oxygen 24/7, 24/7. You have that oxygen mask or nasal prongs attached to your face. You require a hospital bed. You can't get out of bed or leave home without a wheelchair. You might hear a term like wheelchair dependent. Or you have other ongoing chronic infections or chronic conditions such as diabetes or dementia. Diabetes and dementia by itself are progressive illnesses. That means it gets worse day by day. And having a serious illness on top of that could be the straw that breaks the camel back. And at that time, that maybe it's time to start thinking about palliative care or asking about it. Another indicator is progressive weight loss without trying. That weight's just melting away and you can't explain. Frailty. Frailty is a term that really means that you're feeling very, very weak or you've been sick for too long. Your body is no longer able to handle more strain from your illness. Another indicator is having one or more hospital or nursing facility stays in the last 12 months or 2 or more emergency room visits in the last 6 months. All should be red flags that say that, maybe palliative care is for you. Where can people get palliative care? The services can be provided wherever you live, your home. your neighbor's home, your family's home, or in your doctor's office, various clinics and office settings, community health centers, assisted living facilities, different types of care facilities like long-term care or skilled nursing facility, other residential settings, including foster homes and care homes. And remember, palliative care is currently available in hospitals and can now follow you home upon discharge. So who is on the palliative care team? There's a number of people who are required to be on the team to help you with your specific needs. And each person on this list has a role to provide, and they're specially trained in this role to provide that care for you as you need it. So the people who are included on the palliative care team, there's a doctor who provides oversight. There's a nurse, a social worker, a grief counselor who can also be a chaplain or a spiritual support person, a child life specialist for pediatric cases. And then there's a whole host of other people who provide additional support depending on your needs, like a certified nurse assistant, pharmacists, a community health worker, APRN or physician assistant, other types of nurses, and licensed mental health professional. I do want to add that you're not going to get a whole crowd of people in your living room. These people provide their assistance as you need it. And there's a timing in between. So you're not going to get a crowd of people in your house every day. It's as you need it, depending on the needs that you have as you work through your serious illness. How can palliative care help you? They can act as the eyes and ears in the home between your doctor visits. They're an extension to the care team already in place. They can advocate for you and your caregivers, help the communication between different providers. They provide extra support. You do not give anything up. This is care provided along with or addition to care that you are already receiving. They provide 24/7 telephone support. Again, help is a phone call away. At any stage of a serious illness and alongside curative treatment, palliative care is available to help you. Do you have questions about the new benefit? Do you want to learn more? Contact your local agencies providing community palliative care services or talk to your doctor or healthcare provider. And you can research more if you have concerns about your own health or a loved one or relative. And you can talk to your doctor and ask about palliative care or let them know about the issues or concerns you have. And palliative care may be for you. Thank you.
Aloha, my name is Diana. I'm a nurse practitioner and work with palliative care patients at Navi in Hawaii. As a nurse practitioner, I have the privilege of working closely with patients and their families. And I can tell you that palliative care is not just a treatment, it's a compassionate approach that aims to honor and support the person as a whole, in body, mind, and spirit. From the moment I first meet a patient, my goal is always to build a trusting relationship. I want patients and their families to feel that they can share their fears, hopes, and concerns openly, knowing that I will listen and respect their wishes. Palliative care is built on trust, and it's essential that we start with meaningful conversations about what matters most to the patient. This means taking the time to truly understand their values, hopes, and preferences. Every patient is unique, and part of my job is to ensure that their care reflects what they want for their life, their comfort, and their dignity. I always ask, what is important to you? What are your goals for your care? These questions are the heart of palliative care, and they guide the care we provide every step of the way. A big part of my role is also to help patients and families understand the diagnosis that they're facing. I know that hearing difficult news can be overwhelming, and sometimes it's hard to absorb everything all at once. As a nurse practitioner, it is my job to break things down in a way that's clear and easy to understand, and to make sure families feel informed and empowered. It's not just about explaining the medical facts, it's about helping patients make sense of what this diagnosis means for them and their loved ones. But understanding the diagnosis is only part of the process. It's just as important to help patients and families understand the options available to them. Palliative care is not about choosing one path. It's about ensuring that patients have choices that are aligned with their values and desires. It's about exploring all of the available treatments, managing symptoms, and focusing on quality of life. We make sure that the patient is at the center of every decision and that they understand every option before moving forward. Collaboration is also key in palliative care. As a nurse practitioner, I work alongside an entire team of healthcare providers, doctors, nurses, social workers, chaplains, and others, to develop a comprehensive, personalized care plan. We work together to ensure that every aspect of the patient's care, whether it's pain management, emotional support, or spiritual guidance, is coordinated and aligned with the patient's goals. Ultimately, palliative care is about respecting and honoring patients' choices. It's about empowering patients and families to make decisions that will give them the best possible quality of life. And it's about providing support every step of the way so that no one has to face these difficult times alone. As a nurse practitioner, I've seen firsthand how important it is to have these conversations early to make sure that care is guided by the patient's own values and wishes. It's my hope that we continue to raise awareness about palliative care and ensure that every patient has the opportunity to receive this type of compassionate, comprehensive care when they need it the most. Thank you for all your time, and thank you for supporting such incredible work being done in the fields of palliative care.
Hi, my name is Cecilia Ortiz, and I'm a palliative care social worker on Maui. Thank you for attending this training and for your interest in palliative care. As you may know, palliative care focuses on improving the quality of life for individuals with a serious illness, specifically by addressing physical, emotional, social, and spiritual needs. Palliative care usually includes a team of doctors, nurses, social workers, and other support people. The social worker's role is to provide holistic support to the patient and family, enhance emotional well-being, reduce stress, and ensure dignity in care. Today, I'm going to touch on 3 areas of a social worker's role in palliative care: the evaluation, referrals and resources, and advanced care planning. Recently, I met with a gentleman and his family to talk about a diagnosis of serious illness. This gentleman had a very large family, so it was a good opportunity for everyone to get together and provide a space for them to talk about the impact of this diagnosis and their feelings about how it will affect everyone in the family. It was also a good opportunity for them to ask all their questions and to discuss some of their concerns. Concerns included, questions about how much care he's going to need from the family and what that's going to look like. Also needing to take time off work, getting him to his medical appointments, things like that. Also, this gentleman wanted help talking to his family about how to choose an agent or healthcare power of attorney. This is someone who will help you make medical decisions and who will act on your behalf if you're unable to speak for yourself. This is an important conversation, especially if you have a large family with a lot of different opinions and voices. In this situation, he wanted to complete an advanced healthcare directive. An advanced healthcare directive is a document that lets everyone know your preferences for medical treatment, and by completing it, you can ensure that your values and goals for treatment are honored. At the end of the visit, we were able to get him connected with Legal Aid Society to help him complete his advanced healthcare directive. We also helped with resources for transportation to help get him to his appointments and alleviate some of the stress on the family. Our plan is to keep in touch with him and the family and continue to offer support and help connect them with community resources and services as the need arises. In conclusion, palliative care social workers are awesome. They can be helpful in identifying areas where the patient and family may need extra support, referring patients and families to appropriate community resources and services, and can help with important conversations about advanced care planning. Thank you so much for listening. Aloha.
Hope Young is the Advanced Care Planning Coordinator for Kokuamau. Hope joined Kukuamau in 2017 and is a founding member of the Palliative Care Awareness Committee, established in 2021. She provides education and awareness about conversations and documentation about what matters most. Hope has worked with seniors and their loved ones in various capacity throughout her career and enjoys being out in the community. Thank you, Hope.
Aloha mai kako. Now that you've heard more about the MedQuest Community Palliative Care Services benefit, we want to give you more information if you still want to learn more about palliative care. Kokuamau has a wonderful website that has lots of information that you can go and read through. You can watch some videos. These purple buttons on the right-hand side of your screen, those are buttons that have all types of resources for palliative care. Learning more if it's right for you. There's videos, there's stories. There's also a place where you can consider your doctor if he's not sure about these services as well. Some other resources that we want to share with you is getpalliativecare.org. It's a national organization. They have tests and quizzes to see whether palliative care is right for you. Hui Pohala also offers lots of information on palliative care. My personal recommendation is the Conversation Project. A big part of dealing with serious illness is communication. And the Conversation Project has wonderful resources that are available for you and your loved ones to start getting these conversations going about what matters most, especially when faced with serious illness. Some other things that you want to make sure that you realize here in Hawaii is that we have 24/7 support. Should you need somebody to talk to or get medical advice from in the middle of the night, your palliative care team has someone available. It's a team approach. As you've heard earlier, there's a doctor, a nurse, a social worker. There's other team members that all work together to make sure that the person with serious illness is getting the best care possible. This is choosing to be at home with your loved ones instead of at the hospital. This is a way of supporting family and ohana, because lots of times we see caregiver burnout. This is an option that would help with that. This is the opportunity to build those relationships between patients, families, and providers so that everyone is on the same page. This is also a way to show respect for kupuna so that they get the best care possible and that everyone knows what matters most to them. It's not just for the elderly. Palliative care is for anyone who has a serious illness, including Keiki. You don't have to give up anything by getting palliative care. In fact, you're adding to your team of providers that are going to ensure that you're getting the best care possible. You can continue with your medical treatments while you're on palliative care. And this really helps with communication between you, your doctors, and your loved ones so that everyone's rowing in the same direction. For those of you who have smaller screens or are seeing this on an iPhone, I want to read this to you because the font is really tiny. This is a late palliative care referral where the couple is talking with the doc. And then a few minutes later, they're in the rain and the doc comes running with his umbrella and he offers that to them. Here, this will help. Thanks. We wish we had that earlier. Versus an earlier palliative care referral, when they're talking to the doctor, he hands them that umbrella. You may not need it, but just in case. And when the rain comes, they actually have it. And they're so glad we had this when we needed it. So the umbrella is a metaphor. Palliative care is the umbrella. It's not the rain. And predicting the rain can be quite difficult, but having an umbrella won't bring on the rain, but it certainly will be helpful when it does rain. One of our advocates for palliative care shared this with us. I felt like I was drowning. So many doctors, so many medical terms, I didn't understand. My palliative care team took the time to help me understand, to find a way forward that works for me. We're going to show you a testimonial from a brother and sister whose mom got palliative care. Hear their story.
My mom was in the palliative program. She received palliative and supportive care as she was battling breast cancer. When we first heard about the program, she was hesitant to join the program because she felt like it was part of hospice and she didn't really need the hospice care. And a little hesitant about people coming into the home that she didn't know. But once we talked to somebody about the program, she realized that it was very different from hospice and something that could help her along her journey in fighting breast cancer. And everybody who came to help her along the way was very respectful, nice, and very helpful to her. So she was very grateful that she decided to join the palliative care program.
The palliative care really helped us with such things as getting medication. A lot of times too is taking care of the medication list, because it is a long medication list that they have to take care of. For us, we're not registered nurses or anything like that. You know, we can see the list and it's just words to us. But with the help of Palliative, they kind of were able to help us get the medication we needed, and also what kind of medication that we should be providing for her. Because nobody knows what to do, especially with cancer. The 24-hour line to reach the palliative care to get assistance for what we're seeing and what we need really helped us a lot and guided us through the process of assisting our mom the best as we could. They also came down and gave us advice on what we should do to help her out and take the pain off of her, make the situation more comfortable for her. A lot of the times too, the stress on the family is really high because it's a situation that we're not accustomed to. So the palliative nurses came in and really assisted us into making that situation way less stressful and guiding us to the right path at the right time. So a lot of times with these kinds of situations, it's hard to navigate the next step. I kind of advocated to get a social worker. In the end, we were provided one, and through Palliative, which assisted us in getting Medicaid, which helped my mom in the long run, because it's a lot of paperwork that we're not accustomed to.
And then they also provide spiritual care. My mom is part of a church, so she was receiving spiritual care through her church group and the church pastors, but chaplain did come out and speak to her and prayed with her, and she really appreciated that as well. So any spiritual care is helpful during the tough battle of trying to fight cancer.
The assistance that they provided is an invaluable source that we couldn't have asked more for. They were there when we needed them, and they really assisted us.
And I just wanted to say that my mom really appreciated the care that she got from everybody in the palliative program, and it was a peace of mind for her and my dad that they had this palliative care support. So we as the children are very grateful for the program.
Wasn't that a great story? Just hearing how palliative care really supported the family during their mother's time of need. In summary, palliative care is at any stage of a serious illness. Alongside curative treatments, palliative care can help. It can prevent crisis, prevent suffering, prevent family stress and burnout. Really, it's a way to malama the ohana while someone is getting help with a serious illness. It will prevent unwanted hospitalizations and ER visits. And you have access to your care team when you need advice. It's also available to support your caregivers so that they can ask for help as well. You can get palliative care wherever you live or in your doctor's office. Palliative care is available out there. We also want to make sure you realize you're not giving up anything and you're adding to the team. You get extra support 24/7. If you have any more questions about the benefit, we invite you to contact your local agencies providing community palliative care services or talk to your provider or doctor. Thank you for joining us today. I hope you've learned much about palliative care. Thank you to our teams who actually shared with us what palliative care providers do And thanks, Anita, for a great overview on how this can help. Mahalo.
Well, thank you to our presenters. So on the panel now, we have several people who presented, Anita Jewell, Hope Young, and Diana DiBernardo, who is the palliative care nurse. Several people have asked questions already, so I'm just going to jump right into it. Is community palliative care already a commercial health plan benefit in Hawaii? Or do commercial health plan members not have a community palliative care benefit? Basically, if you're not a MedQuest member, how do you find out what palliative care is available?
A great question. Right now, depends on your insurance carrier. So that would actually determine whether you're able to get palliative care. But what we do suggest is that you go ahead and talk to your provider about it and see if they can set you up with one of the agencies that provide palliative care. And those agencies will figure out what your insurance needs are and what it covers. And if you're not eligible via insurance, they may have other programs that are available to offer.
Can I add something? Yes, the answer is yes, there is community palliative care for people who are not Medicaid and have commercial insurance instead. For example, HMSA has supportive care. The VA has concurrent care, and UHA has what they call comfort care. So it's all a little bit different, and the criteria and eligibility is a little bit different from what we talked about for Medicaid. But essentially, anyone, whether you have Medicaid or not, and you have a serious illness and you're struggling, please ask.
Yes, that is the advice that we give. Someone is saying they're struggling with medical issues. The symptoms certainly would qualify them for palliative care, but now they're getting surgery to correct this. What do they do, basically, even if the surgery is corrected? So what do you suggest with people? And, obviously we are not going to answer people's medical conditions today, but if somebody says, hey, how can I figure out if I qualify? What do you suggest they do?
Well, one way is talk to your doctor and let them know what your struggles are and how that illness is impacting your life and your ability to function. That's one thing. The other way is you can go directly to the palliative care agency because people can self-refer and you can talk directly to the agency and they can verify your eligibility. And if you are eligible, they will talk to your doctor, let them know that you can be taken in to participate in the program, but definitely talk to somebody.
Question about social workers. Can palliative care social workers also aid in helping people get Social Security income? And I'm going to put in there other paperwork. So I'm going to answer that. As we heard from Cecilia, palliative care social workers are awesome. And I know that they help with amazing things. Cecilia talked about transportation on the family story. They talked about enrolling mom in palliative in Medicaid. So again, I would say that yes, social workers can help figure out all sorts of paperwork, what's available to people. And usually what I find is if they don't know, then they can help figure out who in the community, again, we talked about those community resources, who can help get that. Can a patient still have a home health nurse alongside the palliative care nurse? And please clarify, a CNA is optional, correct?
Yes, if you're already receiving home health care and have a certified nurse's aide attending to you, that does not need to stop. It can continue alongside of your palliative care services. So there's different agencies that provide the palliative care on island or throughout the state, and they each kind of vary a little bit and how the services work along these other home health care or physical therapy, occupational therapy. So that would be something you could look into.
How does a caregiver begin the process to access outpatient palliative care? Is there a list of palliative care agencies available with phone numbers?
So we invite you to go to the Kukuamau website. There will be a list of providers that are on that website. Look for the purple buttons and you'll find it. Kokuamau.org.
There's a question about how long can a patient stay on palliative care services? And I'm going to answer this one because today we're talking about the new palliative care benefit. And What we have learned is that as long as a patient continues to qualify for this benefit and there's a reassessment that goes on, they can stay on community palliative care. There is no time limit. The only reason that they would no longer be appropriate is if they no longer qualify. So one of the very good things about this, like Anita shared, is that this can start earlier and people can have this benefit for longer. With Dr. Fishberg's story, Bobby got better and didn't need palliative care anymore, to reassure people that this is not a limited benefit. Does palliative care require a referral from my primary care doctor, and will a pre-authorization be needed from my health plan?
Yes, all on Oahu, there are 5 agencies that provide palliative care. And they each have their own version, their own referral form. However, because you are able to self-refer, you can go in, you don't have to have a completed referral form. Then at that point, then they would outreach to your physician, your PCP, to find out, to let them know that you've gone through the process and you want to participate. So yes and no, they all have referral forms, but there's a way to get in without having a referral form completed.
It's really important that you remember you talk to your doctor and see your doctor as the focal point. Someone else asked, when does this start? And I can tell you that the health plans at the moment are working on this. They're working with MedQuest. There are all sorts of discussions going on. Forms are being created. So I would say keep talking with your doctor and, let them know that you're interested. The 5 health plans that provide care to people in Medicaid on MedQuest are all required to offer this. So, this is not optional. This is now mandatory in Hawaii. And so they're working on it. So that's really the good news. What about neighbor islands? Who can we connect with for palliative services?
Again, if you take a look at our website, it will have all the various agencies, including neighbor islands, that you can reach out to and get services from.
Services are available on each island.
What's the biggest difference between the new palliative care benefit versus the old ones? And what are you most excited about in the new one?
It's early upstream. It's really going upstream, so much so that it's being supported and it can be available upon diagnosis, which is not something you hear about very often. People don't get that type of care from the former type of palliative care. Usually there's events that happen and then they try and get them involved, or you have to qualify. There are qualifications that you have to meet in order to get it. But now with this new community palliative care, it's going to be much further upstream to support people where they're at.
For me, is that, clinically, the biggest thing is that it's less restricted. There's less limiting in that more people with a variety of different conditions can now access this type of care. Before, the palliative care services that are still being provided, it's kind of limited in the conditions that you have to have in order to be eligible to participate. And this new benefit kind of lifts those restrictions and limits. And so there's no more time limit, more different variety diagnoses or illnesses are available, are within that eligibility list. So to me, it just broadens the number of people who are eligible and can participate and access this care. So to me, that's very exciting. More people can get help that they need. More people can get help sooner than later. And so there'll be less suffering, less family stress. It's going to be there. It's available.
Great. Well, thank you very much. We hope that you will help share the word about this new benefit. Hope that you'll, be thinking about your loved ones or for yourself, people that you care for. We're going to thank all of our presenters. And for those of you that are caring for people, thank you for all that you do. So thank you for coming, and aloha.